next presentation and our last presentation for the day, and it will be provided by Dr. Luz Lopez, who is once again a longtime collaborator of our center and actually is part of our advisory board. So we are very glad to have her with us once again presenting a great topic, which will be global perspectives and strengths in families coping with COVID-19. Without any further ado, Dr. Lopez.
Thank you so much for this invitation. I want to thank you and say that it's an honor for me to be here today. I want to thank the National Hispanic Latino Mental Health. I want to thank the National Hispanic Latino Mental Health Technology Transfer Center for this opportunity. And I am also so grateful that we have faculty from the National Autonomous University of Nicaragua. It has been a wonderful collaboration, and I thank all the students and colleagues that are joining us today from Nicaragua and all of you in the conference. Muchas gracias a todos por estar aquí. Es realmente un honor para mí compartir y tener esta colaboración. Entonces, we are going to talk about global perspectives, and I want to start by sharing some data. And okay, so the three countries with more population are China, India, and United States. But when we look at the pandemic, the highest country with cases is United States, then India, and then Brazil. And if you see this list, you see that there are a number of countries in Europe and that are also with high numbers of the pandemic. We know that not all countries have the same access to the COVID testing. Again, I'm moving. Globally, 1 in 3 children miss education and access to remote learning due to COVID-19. We see that the closing of schools has been worldwide, but not everybody have access to remote learning or online education. This has been catastrophic for the education system and the life of children. 168 million children have been affected by this worldwide. And the United Children's Fund says that the impact of this is so serious in the life of so many people and families and children. In United States, there was a new immigration law in March 2020. Title 42 of the US Code determined that migrants coming from Mexico were in danger, and Canada were a danger due to COVID-19. This had no scientific basis, but a policy was implemented, and many asylum seekers were not allowed to enter the United States. Instead, they were expelled back to their countries or made to wait in Mexico, on the Mexico border. And you see in this picture how they're congregated and under very poor conditions, and also very dangerous for COVID-19 because of the proximity of so many people waiting in one location. Migrants that were sent to Mexico border prior to the COVID-19 pandemic have been waiting for 1 or 2 years. And the immigration court hearings were stopped or became very limited due to COVID-19. Again, causing a serious problems from immigrants and refugees coming from Central America. Here we have a table from the US-based patrol of enforcement encounters in from October 20 to January 2021. And I want to catch your attention to the numbers of the southwest border expulsions. There were 247,116 expulsions in the southern border with Mexico. If you compare that with the Canada border, there were only 134 expulsions. This is again from October to January of this year. Then if we look at the Title 8 apprehensions, there were 37,293 apprehensions in the Mexico border, while there was only 129 apprehensions in the Canada northern border. In total, 284,672 immigrants and refugees have been in the border, and that's a large number of people affected, seriously affected, after crossing and walking and experiencing so many hardships to get to the U.S. immigration border and not being able to have that access to the hearing. In addition, almost 10,000 unaccompanied children were taken into custody from September to November 2020. That's according to the New York Times. And the New England Journal of Medicine tell us that 10,000 of people remain in crowded immigration detention centers despite the COVID-19 risk. We have a serious problem. Migrant Latinx or Latino families from Mexico, Guatemala, Honduras, Nicaragua, El Salvador are seriously affected by this COVID-19 immigration policies. I know that now the new administration is trying to change some of those policies, but it's a slow process. In the meantime, there are families waiting in the border or families in the United States who have family members that have been separated. These families suffer violence and human rights violations in their country, and then a lot of hardships during the migratory movement. These children also have lack of schools and children education and have suffered the trauma of separations. Access to cultural trained bilingual speaking social workers and psychologists is essential, and we can be of help for these families. In the United States, the Latino, Latinx, and African American communities are disproportionately affected by COVID-19. And as Janer said earlier in his presentation, the reasons are higher rates of work as in-person essential workers. We know that many of the Latinx and African American families work in restaurants, in transportation, healthcare, taking care in healthcare fields, or in areas that are highly at risk for COVID-19. They're also more likely to live in urban communities where it's harder to have social distance. And there are higher rates of diabetes, heart disease, and lung disease. And many of the families don't have health insurance. So many wait to go for care, and this also affects, because by the time they go, it's too late, or the disease is too advanced. According to a Pew Research of 2020, Latinos, Latinas, Latinx, and African American communities in the United States are among the hardest hit by pay cuts, job losses due to the coronavirus. And as you see here, their families desperate because they lost their jobs. That's not only in US, but worldwide. And this creates a lot of anxiety, higher rates of marital and family conflict. During the mental health pandemic, we have seen a rise of mental health symptoms. The adult population is struggling, and there are sometimes few outlets, and there are high levels of anxiety and depression, uncertainty, 31%, high rates of trauma-related symptoms and disorders, and an increase in substance use. and also an increase in suicide thoughts, and suicide rates. This is based on the Center for Disease Control data. During the COVID-19, many children are learning and attending school remotely. And I know teachers are doing their best to provide services to the kids and to be creative in creating ways to provide the education. But we have many mothers and parents who are also working from home and very stressed, and this creates a demand of the parent and child diet, causing profound changes and stress in the family routine. Many times a mom has to stop their work to come help a child who is doing remote work. And then the child is also frustrated through being in Zoom, not being with their friends, and having a harder time learning. And many times seems like there is no solution. We as social workers and psychologists and providers can help families in these situations. And telehealth is one of the ways that we are doing it. Many social workers are providing that service. And in telehealth, you can ask the family how they are doing, and you can see them through the screen like we are doing now, which is excellent, and you could provide services. But sometimes you have to be careful because we don't know which other family members are in the room. It's very important to ask in a telehealth session who else is in the room, even if they are not in camera. Is there a private room where you can have a discussion? And can you have a discussion with the child separated with of the parents, and use play and games to talk to the child, and then other tools to talk to the moms? Again, this is an excellent tool that is available now, but also we have to be cautious of how it's implemented. There are also situations of domestic violence where children or family members are at risk or are suffering in silence because they no longer have access to the teacher or the school system that will provide protection in the past. And you can assess what the situation is through telehealth and finding a moment where the person can have a private discussion. And if it's not verbal, sometimes you can use the chat in the Zoom or in WhatsApp to write, so the person maybe can disclose what's happening without putting the other family members or themselves at risk. We also have witnessed a great deal of strength and resilience in children and families. And we see in this table all the characteristics that are needed for resilience. And we have seen a great deal of willingness to adapt, to be flexible, to solve problems, to have emotional awareness and social support. And sometimes a sense of humor, playing games, going outside, getting out a break from the routine help the families. We also have seen tremendous resilience incorporating digital technology in learning and human connections. And we find out that grandmothers, mothers, my mom, who is 80 years old, learn now computer and is learning Zoom, has been able to join family meetings, and there are other grandmothers, abuelas, que están aprendiendo, so they can be connected with their family members that they cannot join physically, but can join through these measures. And the children are also being very resilient and creative through the learning, remote learning and online learning. Families coping with COVID-19 need to use appropriate language to explain to the children what's happening. Sometimes the children have many questions, the uncertainty that we as adults experience, and they want to know how long this is going to happen, when can we go back to school, when can we see their friends, and they are dealing with grief and loss in the same way that we are dealing with grief and loss. So the parents can explain to the child what's happening very openly and support them and validate their pain. And also collective activities that you can do outside could help to create a space so the children can express their fears and uncertainty. And keeping rituals and tradition is also very important. In Mexico, there is the Dia de los Muertos that is celebrated in October. And those traditions are being kept during the pandemic times. We saw many families using pictures and Zoom to connect with other family members and putting pictures of their loved one that passed away and celebrating in their homes, but being connected and using creative masks, creating activities. Sometimes they did the same recipe together, 2 families did it or 3 families, and they were sharing the meal in the same way, but through the camera and feeling connected in that way. People have been able to connect even more because sometimes people that were not able to travel to a family gathering now are able to be present through Zoom or WhatsApp or these technologies. There have been a boom on innovative best practices and guides available for online learning. And we have seen teachers, educators in both in school, middle schools, and higher education creating new ways to provide the education and having access to the learning through computers, but also through smartphones. Many children don't have access to computers, but they have a smartphone and or an iPad, and the people are coming up with new ways that can be implemented even post coronavirus pandemic. And children are adapting to new guidelines at school. As you see, there's more distance now. They have to wear the mask, they have to adjust, and it's not easy for young children, but they are adapting. And as more children now in the United States and other parts of the world come back to school, we have to talk to them about how to continue maintaining those safety measures and being open and connecting with their friends, even when culturally it's very hard not to run and touch them or play with them physically, but maintaining the distance. And but talking about what is the impact of that and how can they adapt to that situation in everyday life in school. Las abuelas, as I mentioned, are learning also through the phone to maintain connections with their family members and connection with each other, which are new ways also to connect and to see their family members and to express their fears and their concerns. And we have seen also in hospitals with patients who are suffering from COVID-19, how essential it is to have a phone or a way of communication when family members cannot come in person to be with them. The nurses have been so generous helping with this process, providing a phone or an iPad to the people that are in the hospital, so families can be with their loved ones even in a time that of so much hardship. So we have seen that in these times, people are coming together and supporting each other. Communities are coming together. Church groups are coming together, or faith groups, or community clinics, community organizations. We can achieve more equity during COVID-19. And Haner had a picture before in the baseball site. And I have here another example. Is through a bicycle. And in the first picture, you see that equality is the same bicycle no matter what, but equity is adapting the bicycle to the needs of the person. And that's what we want to do in this pandemic. Adapt the bicycle, adapt the evidence-based interventions to be appropriate for the families and the individuals that we are serving. One intervention doesn't fit all. We have to assess what is the situation of each family and adapt to that situation and see how can best help the member. And and everybody can ride the bike. Everybody can have access to better care if we as providers take the time to do those cultural adaptations, especially for Latinos and immigrant communities. Also, we have to think of the many immigrant communities that are undocumented in the United States and have no access to medical care or testing. We have to think of them and see how can we provide care and prevention care during this time. This month is Social Work Month, and I want to congratulate all the social workers that are listening today and all the social work students. And one of the aspects also that has been a strength during this pandemic is the interprofessional collaboration between social work, public health, psychology, health providers, educators. We are bringing our expertise to collaborate together and make a difference. And I am so thankful for this virtual conference today and the opportunity to work with our colleagues in Nicaragua, our colleagues in Puerto Rico, and the colleagues from Central America and Colombia who are listening to us today. And now I want to invite a research fellow. These are some references that are available, and you have the handout available. I want to invite Natalia Jimenez. She is a research fellow at our Center for Innovation in Social Work and Health. And she's going to now share some of her experience dealing with this pandemic. We thought it would be good to hear a first-hand experience.
Thank you so much. Oh, thank you so much, Luz. I'll go ahead and introduce myself. My name is.
Before that, I would like to stop sharing the presentation. Cindy.
Yeah, let me just help you with that. Sorry.
So we can see Natalia better.
I'll go ahead and introduce myself. My name is Natalia. I'm a current second-year student at Boston University School of Social Work. I'm currently pursuing my master's. Like Lou said, I am a research fellow, and I've been working with her for the past couple months. I'm so excited to be with everyone today, and thank you all for the presenters and Luz that have presented today. Just a little bit about me. In terms of how I identify, I am a Latina. I'm an immigrant. My family is from Colombia. And I wanted to go ahead and introduce myself in Spanish también. So, mi nombre es Natalia. Soy una de las estudiantes en el programa de Boston University de la Escuela de Estudia del Social Work. Ha estado trabajando con Luz estos últimos meses. Como un research fellow de pues todo lo que está pasando con COVID de un perspectiva global. Entonces, quería estar hoy con ustedes también para decirle un poquito de mi experiencia de cómo ha pasado, cómo el COVID me ha impactado a mí. So I'll go ahead and continue in English. I think for me, in terms of when looking at COVID and a little bit of what you were talking about in your presentation, I would say for me, some of the challenges that I know that me and just not myself, but like me and my family have had is in result of, you know, like you said, Latino and Latinx people are a very big community. We're very big on, you know, gathering together and being able to share, whether that is holidays, whether those are birthdays, special occasions. And I think that one of the biggest impacts, I think, for me and my family have just been the lack of being able to meet together. You know, my family is very close. It consists of my parents, well, my immediate family, my parents, and my younger sister. And even though I was privileged enough to go just see them for the small break that I had during the holidays in December, I have seen in terms of just, you know, that wasn't able to be expanded to my extended family, you know, like the family that I also have back in Florida. That's definitely been like a challenge for us. We're always used to, just gathering together, and sometimes we don't even need a reason to gather. We just like spending time together. So I think that's been one of the challenges in regards of, my family. Something that I know that has been also mentioned in the presentation is that, I know it happened within my family, and it has happened within a lot of Latino and Latinx families, that, where you weren't used to at a point having like everybody at home. So I know that that was one of the major effects. Normally, everyone's like everyone's going to work, or everyone has school, and school is normally like, in person. And that's been one of the challenges in regards to, being able to manage what that looked like, and being able to work through that as a family as well. I wanted to also talk about some of the resiliency and some of the coping strategies that we've also been able to do. And I think for me, in terms of, with my family is my biggest support system. So I think that even though it has been a challenge, I think that I've been able to, lean on my family as a support system in order to, be able to cope through the challenges and some of the losses that you have mentioned in terms of the pandemic. I know for myself, I moved from Florida to Boston to attend Boston University for my graduate program. And obviously, I had a different idea of what my master's program was going to look like. I was fully in person and I was full time. So that's also been like a challenge in regards to the loss that I've experienced. But one of the strengths and has been my family in regards to the support that they've given me.
Yes, and I know that it was such an adjustment to go from being full-time in person to remote learning for the classes and the internship, which is one of the major components of social work. And I know also that your family is from Colombia, and that you are the first one in your family to go to graduate school. So you were looking forward to that moment of your family together. Can you talk a little bit more about that?
Yeah, so like you mentioned, I have been the first one in my family to be privileged enough to get to go to graduate school and pursue my master's. So I know that was a big deal, not just, for my immediate family, which are my parents and my younger sister, but also my extended family, both that live in Florida and that are currently in Colombia. I know that has been like a big talk, and I feel very honored and very privileged to be able to be in that, which has been the strength about that. But like you said, one of the losses or the challenges that I have experienced is that, due to the COVID pandemic, graduation isn't going to look like it normally looks like. And I have the privilege to graduate in May, this May. So I know that one of the losses that I know my family is experiencing is the fact that, they won't be there. They won't be able to be in person that day, see me, if I'm able to attend the in-person graduation, see me walk across the stage in receiving my master's degree and my diploma. So I know that has also been one of the biggest ways that like the COVID pandemic has affected me and my family as a whole.
Yes, and I think many of us have experienced that, missing graduations or weddings or baptism, not being able to travel and be in person, accompany your family members is a big challenge. And at the same time, we're finding ways to communicate. I also want to share with our audience that last year we were able to go in person to Nicaragua and do work there. And we were looking forward to doing that this year. And of course, it's not possible. So that's why we are so grateful to be able to still collaborate and do this virtual conference together, because we can bring them people in Nicaragua to us and us to Nicaragua, and we can share expertise, best practices. I was very thankful to hear about the mochila emocional backpack and how we can apply it. And in that way, we can share resources and share activities and share ways to cope and to keep going until the pandemic gets solved. You are studying social work. What will be a message that you will give to in this month of social work? What message will you give to other students or other colleagues who are listening?
I would say in terms of just as a, I'm only one person, so I can't speak for the entire community, but I would say in regards to one piece of feedback that I would give them would just be keeping aware that, the Latino and Latinx community is a big community. It is made up of a lot of cultures, countries, different backgrounds, different languages, traditions. And the importance of making sure that we're not just put into like this I would say like a box in terms of making sure that we take the culture and the individual as they are. Just yes, like we do have a lot of similarities, and one of them is a language and a culture, and sometimes some of the traditions that we do. But it's really important for us to also say, I'm just using myself as an example, like I am just, one Latina that, and this was just my personal experience with COVID. If you talk to somebody else, and even from my own country, they might have a different experience in regards to how COVID has affected them. And when you think about also, the difference, how is it affected the Latino and Latinx community for the Latinos and Latinx people who live in the United States compared to also the ones that live in Latin America. So just keep that aware in terms, because there's a lot of factors and there's a lot of dynamics that go into who we are. And it's important that, yes, the community is alive and it's important for us to gather together. But, in terms of social worker and clinicians, it's very important to keep that in mind.
Yes, very good, excellent. I think we have to know who we are, to know our own cultures, our roots, and then take time to get to know the other and learn what experiences they have and adapt, as I said before. I'm from Puerto Rico also, and I am very honored to be doing this workshop and having collaborations with colleagues from Puerto Rico and from other parts of Central America and Latin America. And I think we have an opportunity to collaborate, to have interdisciplinary collaborations, and to work on creating evidence-based practices post-COVID, because the impact of COVID is so serious right now. So many families have lost family members, so many children lost their parents, and so many families are struggling financially, economically, and education. It's a time where social workers, psychologists, all of us are essential. And it's a time where we can rally together and see what can we do. And sometimes it's accompanying someone, accompanying in that moment of grief and loss, and being there, and then trying to do more advocacy for those families that need the access to services. We need to continue advocating for changing in policies, so more testing, and now the vaccines that are coming up are available for everybody, and that we really handle these situations. We are very, very grateful for the opportunity to be here. And now we are going to open up for questions from the audience.
Go ahead.
Or comments.
Okay. Someone asked about China when Luz was sharing one of the initial charts. I guess you showed up a chart where China was not in it, and they were asking like, where is it? Like, why it wasn't on the chart? I'm not sure which one was.
Yeah, it was the second slide. In the first slide, I show that China is actually the country with the largest population. In the second slide was not there because they are not one of the largest populations. At least they are not reporting COVID. The slide show um, the largest populations with COVID right now are United States and India and Brazil, not China. I thought that is a significant finding. I also want to take this opportunity to acknowledge that there is also a lot of stigma and prejudice and xenophobia against Asian and Asian American groups. And we have seen the injustice of violence, verbal and physical violence against Asians due to the stigma of the origin of this disease. And we need also to advocate to eliminate the stigma that is so unjust. And also for that reason too, I compare those two slides because there are a lot of misconceptions outside.
Thank you, Luz, definitely. Someone also wrote here thanking Natalia for sharing their perspective.
Excellent.
Welcome.
Remind everyone that you can submit the questions to the question box or the chat. And then we have another one. It says, first, I want to say thank you, Natalia, for sharing your story with us. It is very relatable to many of us. Do you have any tips on navigating the work life during the pandemic?
Was that from okay? Wasn't sure. I think for me, it's been rough. I'm not gonna lie. And just for the sake of transparency, it has been. But I think one of the things that I've been able to really lean on, and I think that I mentioned it a little bit before, was in terms of finding that support group, finding those people in your life that can really understand the work balance in regards of what you deal with on a daily life and are able to support you. And I think another one, I think just for myself, has been being able to advocate for myself, being able to whether that is talk to my professors, whether that is talk to my current supervisor, current boss, in terms of if I seem like there's a lot going on right now or I have too much on my plate, just being honest with them and letting them know that I'm either struggling or this is a lot in terms of I have a lot of assignments, or I have just a lot of deadlines, I think the probably word the best word would say, in terms of making sure that way we don't feel like we're taking on too much, because the work-life balance can already be difficult as a graduate student, and if you add a pandemic obviously on top of that, sometimes it can hit you from very different lenses and very different angles. So I would say my biggest piece of I guess feedback or advice would probably be in terms of finding that support system that you're able to lean on during these difficult times, but don't be afraid to ask what you need, from either that be from your school, from your workplace, whatever you feel like you need at that moment in order for you to be the best and be successful, I would say.
And in terms of work life and everyday life, I will say not to be afraid of going to ask for help. I think in our community, there is a lot of stigma about mental health or going to a social worker or a clinician. But families need support at this time, and we should work to not be afraid to say, I am in a situation and I need help. Our parents are overwhelmed being at home and with the children at home, and and sometimes limited flexibility of what they can do. So it's okay to ask for help, and for us as clinicians to offer that support. And I think it's a dual process because we're offering the support, but many of us are also experiencing the same stress with the job being remote or teaching in online, or having children at home. So it's a dual process of taking care of ourselves and being honest with ourselves, and at the same time helping the other. And we also need peer support and from each other, to say, you know, when this is hard, acknowledge this is hard, and I'm frustrated. I cannot go back home at this time, or I cannot see my grandparents, or it's too much, the work at home, and the work with the children, whatever the situation is. But we are in a dual process of care, and being honest and supporting each other and continue this collaboration.
Yes, I agree.
So maybe something we can do is ask the team from Nicaragua if they can join us again, and maybe we can open up the questions for all of us. If Liana is there and come back, and the team.
Yes, here we are. We had to move off the room because we have no power. And so we had to move to another lab, and here we are. So
I see Liana, I see Lineke Palacios,
right here,
y Tania, ¿está Tania? ¿Está?
Here? Yes, she's here.
Excellent.
So if you have more questions or you want to hear some experiences or something, we are here. And of course, we are open for more collaboration to develop more projects together.
We just received a question, and I think it's for everyone. So I'm gonna go ahead and read it, and I would say Luz, start, because on my end I see you first, and then Natalia, and our colleagues from Nicaragua, so that way we all know when each one can talk. So I'm gonna go ahead and read the question. It says, as Latinas, what is your opinion of what needs to be done to reduce the impact of the virus that is having in our community?
I think as Latinas and Latinos, Latinx, we need to continue raising awareness and prevention methods, and also making the mask accessible to everybody. I think in some communities it's really hard to get access to those preventive measures. So I'm hoping that we can advocate for more use of mascarillas, masks, and in schools, the children are coming back to school soon, and I think teachers and parents need to talk and make a plan of how to continue the prevention measures, because it could be dangerous if everybody comes back and people don't follow the guidelines. I also think that we need to do groups like this, or small groups discussions, to see in each community, a small community, how can we reach those who are in rural areas or those who have less information, and translate in Spanish, for example. I think there's a lot of information that has been distributed, but not all is available in Spanish or culturally adapted. I think also there is a lot of fear about medications and vaccines. We need to educate everybody and understand and hear where people are at, and go at the pace that people are and continue with those prevention measures. And as public health social workers, we can educate other families. Natalia.
So a little bit of going off of what Luz already said, in terms of, just advocating and information, but I would say also to add on that, I would look at it from two different perspectives. And as a social worker, I would look at it from a policy level. I think in terms of, with the current, I would say political climate and administration, in terms of, finding, the most appropriate, like, equitable policies that, are able to, be looked at in terms of why it is that, like, Latino or Latinx communities are being affected by the COVID virus so heavily compared to other communities. I know Luz talked a little bit about it in her presentation today, in terms of, like, a lot of Latino or Latinx communities are, made up of a lot of undocumented communities, who have, like, lack of access to healthcare, whether that be like a primary care, whether that look like in terms of even getting educated on the virus, and from like what Lou said also in terms of a bilingual, because a lot of Latinos and Latinx people, like, speak Spanish, and in terms of finding, the language barriers, in terms of, providing more education on the virus, and how it is affecting the communities, both from a family level, both from an individual level, and really adapting it in terms of, like, within each, also in the Latinx and Latino communities. I would say something from even like a community level, in terms of being able, in order to do that, being able to have those, Spanish or Latino and Latinx, like, healthcare workers, social workers, psychologists. I think that's also a big thing, in terms of being able, to come in and help, like, your own communities, and being able to, I think that there's a very big empowerment in knowing that you are a part of the community that you're serving. And I think that is very impactful in terms of something that we as social workers, or just like the healthcare and from a public perspective, should be doing. So that's what I'll say.
Lineke, and Tania, and Leana.
También algo muy positivo en Nicaragua es nuestro modelo de salud, el cual es muy es preventivo. En todas las áreas siempre se trabaja mucho la prevención. También surgen algunas ideas a través de las ponencias, como el seminario sobre calidad o calidez, calidad o calidez para atender a las personas, trabajar también la parte de las emociones siempre y el aprendizaje con los dispositivos electrónicos, ya lo mencionaban también ustedes, ellos, también con los menores de edad, y hacer como esta reunión generacional para que juntos también podamos tener esa parte en la calidad y la calidez de la comunicación. También estaba la virtualidad y el COVID en los tiempos que estamos. Podemos hacer que se compartan, o sea, para las familias también en este sentido. Entonces hay muchas estrategias para trabajar y ser un poco, o sea, ser muy resiliente también.
Liana. Liana, it's going to translate?
Yes, sorry. I thought I was translating, but it was, the audio was, sorry. So what Lineker says is that we have been working in Nicaragua in a system which approach is prevention. So that has helped a lot because we work on prevention. And also because this gives the opportunity, this kind of activity gives the opportunity for us to contribute with different ideas. As Latinas, what can we do? We can develop more seminars about quality and how can we attend people, how can we help people, and how we can work with emotions and learning how to use technology like smartphones and youngers and elderly as well. And also we can have a next conference. We have a good topic we can work on, or some collaboration work about virtuality and COVID-19, more time to share in safe families. Tania wants to share something as well.
Pienso que las habilidades adaptativas tomaron más relevancia que nunca desde que apareció la pandemia. Y es trabajo de nosotros, los que trabajamos toda la parte social, hacer que las personas piensen en el desarrollo de habilidades adaptativas para pasar las etapas que va teniendo el COVID de una manera más adecuada. También pienso que la fusión de ideas en sentido de desarrollo social es importante para que también dentro de la comunidad universitaria, en el caso de nosotros que estamos aquí, pero también para el beneficio de la comunidad, nos toca a nosotros o nos corresponde llevar esa reflexión o ese pensamiento más profundo acerca de lo que vivimos en relación al COVID y escuchar a la gente pues que lo necesita.
So another important thing is that during this pandemic, adaptive skills have been an important thing, because that's the way we can succeed. And as social workers, we can develop some ideas on some strategy to work as a social community development.
Excellent.
Thank you all for answering that question. We have another one for all of you as well. And the person asking the question says, I'm wondering what is going well for people and families, and if the changes from the pandemic, if the changes from pandemic created changes that will be good to keep.
Yes, I totally agree with that statement. Thank you for that question, because I think that we can maintain many of the adaptations that we have done, we can keep. I think, as I mentioned in my presentation, technology has brought people together, grandmothers together, and we have found ways to keep connecting, being social distance, but emotionally close. Families that sometimes didn't visit each other so frequently now are meeting weekly by Zoom or WhatsApp. So I think this pandemic has brought people together. People also have shared moments and traditions together, and also the adaptations that we have done to curriculum and in the education system, I think that could be kept and implemented. New ways to develop interventions, and we are those adaptations and public health prevention strategies can continue being implemented for the health of all of us. And also time to appreciate the little moments that we have together, the times outside. I think now when we go outside, we appreciate more the flexibility sometimes that is needed at work. I think people are being so productive and creative, and time, the sense of time has changed. Traveling to work or coming to work, those moments now have given us more opportunity to reflect and to continue growing and connecting with each other. Another wonderful thing is these connections that we have had thanks to technology. We are able to be in Nicaragua in this classroom right now. And I think globally, this is a wonderful opportunity to continue global collaborations, to share ideas of what can we do together, and how to listen to people's needs, and how to respond to those needs according to each country. And this, I think, is just the beginning. We can continue doing more collaborations and applying best practices. We can learn from best practices in other countries, and we can share what we have.
I would say for me, I think one of the best things that we should definitely keep is just the importance of having these conversations within our communities and our families, and knowing, the ability to be able to, I know a lot of it has to do in terms of like the emotional support and being able to have those conversations and know that, this was a really big struggle for the community in general because of many different factors, and it brought up a lot of things that maybe, because of other life and because of work and school and everything, like we weren't really talking about, whether that be mental health, whether that be public health, with our everyday lives, we weren't really talking about, the impact of mental health and how that was, impacting us as a community, or the issue of like policy and public health. And I think that, with COVID-19, we were able to, be able to start those conversations and continue those conversations with that, which I think is something that should, continue, like moving past this, and the importance of community, like Lou said, and being able to really like listen to each other and learn from each other, and know that, us collaborating even with this event, I've learned so much, working with Luz and working with everyone from Nicaragua, and the ability of like the resiliency in the communities, and like from an individual level, and then like I said, a community level. And I think that these conversations should continue, in terms of being able to provide and seeing us like move forward and what it is in fulfilling our needs, I would say.
A mí me ha hecho mucho las presentaciones de ustedes y lo que expresaban, valorar nuestro sistema de salud y educación, porque no ha sido para nosotros, como para ustedes, por ejemplo, un problema hablar de la equidad y de la igualdad de oportunidades y beneficios para toda la gente en la comunidad, porque el sistema ha permitido que la gente tenga apertura para educarse, para recibir servicios de salud de manera equitativa. Entonces, eso es algo que veo muy bien, que no lo hemos valorado, pues, tal vez de la manera adecuada.
Something Tanya wants to value through after this morning is that we have some differences, especially around policies, because for you has been a big difference with the policies because of equity. And here in Nicaragua, we haven't mentioned that we have had problem on educations or health system, because here we have access and the policies are in favor to us in that way.
Okay. También se puede mantener toda la dinámica a través de las políticas públicas. Mencionaba Natalia también una parte importante que también podemos compartir acá, porque en nuestro Programa Nacional de Desarrollo Humano, desde la parte del desarrollo social, en el eje número G, así está contemplado. También se trabaja la seguridad en todas sus formas, y desde ahí podemos trabajar con estrategias, trabajar los cambios de manera paliatoria o de manera asertiva. Entonces es significativo también el hecho de mantenernos y de mantener el cambio de una manera positiva y resiliente.
So it's very significantly and important to keep these changes as a resilient way. Here in Nicaragua, we can see that protection is one of the main actions for the National of Human Development Plan, and that's why we have had a lot of succeed, if we can say, during this process.
Muchas gracias a todos por las preguntas y los comentarios y por este panel juntos. Y Cindy.
Yeah, sorry. Thank you. Myself. We do have more questions for everybody. The next one says, in what ways can we encourage others to advocate for immigration issues as well as COVID-19 protection for the rural Latino communities? Many of these areas face the fear of police presence due to being undocumented. How can we bridge this disconnection?
I think that's such an important question, and it's an area that is very dear to my heart, because we have a number of undocumented families here in Boston and in other parts of the U.S., especially in the southern border. And we need to continue educating ourselves and advocating for policy change, so the access to information and healthcare is more wide, and there is a law that if somebody, an undocumented person, goes to the hospital for care, they cannot be deported. And I think many people are not aware of that, and they need to have more information about this and other aspects. And again, we need policy changes, and as social workers, we can advocate with the legislator and with the administration, so these changes happen more quickly, so families that are in those rural areas can feel more safe and able to reach out for help. And families who are in detention centers, or families who are separated, need to be reunited. And we need to really advocate in each of your states, learn what the policies are, and call your legislators for these policy changes.
Yeah, I'm going to go ahead and also agree with a little bit of, or actually a lot with what Luz said. I would say in terms of, as a future social worker, and I would say in terms of, being able to advocate for a lot of the Latinx and Latino communities that are undocumented, would be the biggest way would be on a policy level, and those people who have the privilege in order to be able to either work with those communities and figure out what it is that that they're needing, what it is that they're lacking, and being able to take that information back and call your representatives, whether depending on the state that you're at, get informed on what the current law is or the current policies are in terms of undocumented with healthcare, whether that be or education, and what that looks like for them, in order for us to be able to understand what's currently going on and look at what's currently available and seeing what is lacking, and being able to advocate for that. Looking at the current policies will get us a better idea of where we're at, but it also will get a better idea of where we can go and what we need to continue advocating for, and being able to call your representatives, get involved in your community, both on with families and individuals, whatever that looks like. I think that's a big thing about it, in terms of just getting involved with different organizations that are going on, in terms of people that have already been doing the work and have been advocating for undocumented populations, especially with the Latinx and Latino area, and see what they're doing, and see how we are able to advocate for them more.
Thank you, Natalia. Liana, I don't know if you want to add something as well.
Well, in this case, we haven't discussed about migration, but what we were discussing in here was how can we work with people to stay here and avoiding migration, as even in Nicaragua, migration to United States is one of the less, the minimum percentage comparing to the other countries in the region in Central America. So the way we are working is innovation, encourage people to create their own business or help each other to work each other. And as the university, so we are helping students to develop some skills and also to contact people with this attention. We give contact people if they need with the Minister of Family or Minister of Health, or if we find some cases of violence, so we contact them in those cases if it's necessary. So we support them with lawyers or other things we can do.
And one more thing is for clinicians to learn more about trauma care. I think the impact of family separation or losses because of COVID or the disease, the uncertainty of the long-term effects of the disease, or having families in hospital because you're undocumented or immigrant or in a rural area, you cannot be present. This causes a lot of stress, anxiety, and trauma. And for families who have been separated at the border, long-term trauma. So we need to be more trained and able to provide that service for families.
Thank you all for those answers. It's definitely a very important topic. We have another one, and it says, as a clinician that works with undocumented immigrants who have and continue to experience extreme levels of disparities, how can I advocate on a larger scale outside of the systematic barriers in place?
I think, as I said before, going in your local state to the legislation and seeing what advocate for policy change in your area, and also at the national level. I know that the Biden administration is implementing some immigration policy changes, but the changes are slow. So we can advocate and learn what can be done state by state in the meantime, and also at the federal level, and push for those changes.
As a future clinician, I would say that kind of going off of what Luz said, I think it really just depends on, you can do like a national and a state level, but a lot of it is really done at like your local level, in terms of, like, for example, depending on the organization that you work with, or like for myself, I am really interested in education and education policy, and currently working at a school, in a high school, and being able, as a clinician, to see, which one of my students, are having those disparities, and how I can even advocate for them in terms of whether that is like learning, like whether that is, how are they learning? Like, is that impacting their learning? Are those disparities impacting them on an educational level? Are they impacting them in terms of like behavior, social, emotional disparities? How can I advocate? And a way I can advocate for them is, talking to the administration at the school, talking to the deans, talking to the head of school, talking to, the teachers, the social worker at the school, whoever is a part of that, and knowing as a clinician, knowing that like I can even advocate at my current place and at work, making sure that, those students who are undocumented we are working towards eliminating those barriers, whatever barriers it is that we can do. And that's just at your organization level. Like Lou said, you can do it at your state level, you can do it at a national level as well.
Sorry,
so
could
now
you the question?
I'm sorry, you want me to repeat it?
Yes, please.
Okay. So it says, as a clinician that works with undocumented immigrants who have and continue to experience extreme levels of disparities, how can I advocate on a larger scale outside of the systematic barriers in place?
Bueno, actualmente no trabajamos con indocumentados, ya que es mínima la cantidad de personas que migraron, pero sí trabajamos la parte del duelo con la familia. Y una de las estrategias muy importantes fue la parte virtual, cuando hacíamos tal vez preconsultas o consultas con nuestros celulares y las familias tenían acceso a un celular, entonces podíamos comunicarnos de esta manera y hacer un seguimiento o un acompañamiento desde la parte virtual.
We haven't worked with the immigrants, but we have worked with some relatives or some people who have some relatives abroad and are in the same conditions. So we were working on grief and loss and how to manage those emotions. And they had to get another strategy, and it was virtual help. They had some attentions or social or psychology attention through virtual connections. So they could have access through their phones or different social media to help them to support, to receive this support.
So I want to thank everybody that is listening. It's now 12:30, and we are gonna give you time to complete an evaluation and maybe say last comments. But it has been wonderful to have this collaboration, and I want to thank Natalia and our colleagues in Nicaragua, and again the National Hispanic and Latino Technology Transfer Center Network for allowing this wonderful opportunity.
Thank you, everyone, too.
Muchas gracias a todos.
Thanks, everyone. Gracias. Gracias por su apoyo y oportunidad. Thanks for the opportunity and support.
Ángel. No.
You're
No
muted.
te escuchamos.
No.
Let me see if I can help you there.
And Cindy, thank you so much for helping us with the questions and for all the work behind the scenes with the technology.
And don't worry.
And thank you for everyone who asked those questions. They were great questions, so we really appreciate that as well.
I don't know what's going on with Angel. Let me just see if he wants to call me, and we'll just do it that way. Okay, you're live now.
I'm sorry for that. I don't know what's happening. I can't unmute myself, but I heard all of you for those great questions. Thank you, Luz, and thank you, Natalia. Thank you, Leana. Thank you to all the team at the University Nacional of Nicaragua. We are very glad to have this opportunity to have this space to discuss some of these very pressing issues for our community. We know that Hispanic and Latinos have faced a lot of barriers in the services that they receive throughout the decades. And now these inequities have been exacerbated due to the COVID-19 pandemic. And we see this in lots of different scenarios. Our communities are facing poverty more than ever, are facing needs of food, needs of services, and mental health. And although there's a lot of negative aspects of the pandemic and how it has impacted our communities, we also have some positive aspects like, well, Dr. Luz Lobet mentioned, and is that we have found other ways to make our connections more meaningful, and even more so, we have identified once and for all that these connections are truly meaningful and are truly needed, and we cannot live apart as many can think. So I am very glad to have this opportunity to be with all of you and discuss these pressing issues, and hope we can continue to do this in a future occasion. I would like, Cindy, I don't know if you can present my slide so I can show everybody the the evaluation so they can fill out. It's very important for everybody to fill out the evaluation for the CEUs, and also it helps us to continue to provide services free of charge, like the ones that we are discussing today. Cindy, I'm not able to. Oh, I think I can now share. And
let me see. Whoops. Let me. I'm sorry, everyone. I'm trying to help him. If he can't, I'll just connect it. Okay.
Hello.
Yes.
Can you hear me now?
Yeah.
I'm not able to present my slides, so Cindy, could you share it so people can look out on the evaluation? I can also try to paste it. I'm not able to use any of the commands, so if you could help us with the evaluation, so participants can fill out for the CEUs, and also help us with future endeavors of this nation.
Yeah, I'm opening up the PowerPoint right now so I can share my screen. Give me a second. Here we go. Screen.
Gracias por su
There we go.
paciencia.
Thank you for your patience, and actually this is some of the technical difficulties that we face through the COVID, but we continue to move faster. On screen, you have the information for our center. You can reach out for us. We provide technical assistance and training free of charge, so feel free to disseminate with any of your colleagues. And you can also scan our evaluation through the QR code, or also accessing it through the survey, that link that is on screen. So once again, thank you to the team at Boston University, Universidad Nacional Autónoma de Nicaragua, and we are grateful for all of you to be here today. Have a great day.